There's some exciting news here on the south side of Chicago as University of Chicago Medicine announces plans to build a new $600 million, 500,000 square foot cancer center. This will be Chicago's first freestanding clinical cancer center. The new facility will also fill a critical need for the south side of Chicago by providing the very best in cancer care. Today and at the forefront, we'll discuss this new cancer center and we'll talk about the impact it will have on the community. That's coming up right now on At the Forefront. And we want to remind our viewers that today's program is not designed to take the place of a visit with your physician. Let's start off with having each one of you introduce yourself. Tell us a little bit about what you do here at UChicago Medicine. And Brenda, you're at the desk. We are distancing because of COVID, so Dr. Smith is on the other side of the room, but let's start with you.
Absolutely. So I'm Brenda Battle. I'm the Senior Vice President for Community Health Transformation and Chief Equity Officer here at UChicago Medicine. And my role is to really look at complex health and social issues that impact our community and bring solutions to address those in collaboration, obviously, with community providers and our teams here at UChicago Medicine. So glad to be here.
Great. And Dr. Smith, let's go with you now.
Great. I'm Dr. Sonali Smith, and I am currently the Chief of Hematology Oncology in the Department of Medicine and co-leader of the Cancer Service Line. I take care of patients and I do clinical trials, and I am so excited to be here.
I said this in the intro a few minutes ago, but we're at a time here at UChicago Medicine, in my opinion, that's one of the most exciting times, I think, probably in the last at least 5 years to a decade. And I've been here a little bit over 5 years, and this is, I think, the biggest building project we've had in a long time. But it goes beyond that because it has, there's such an impact, I think, that will happen with the community. And Brenda, I want to kind of start with you and just let's talk a little bit about that, because this is a big deal for the community and for UChicago Medicine.
Yeah, absolutely. It's a big deal. So we know some of the data on cancer outcomes for persons on the South Side. Cancer is a second highest cause of death for persons on the South Side, and we have one of the highest rates of diagnosis in the later stages of cancer for Southsiders. And so this idea of creating access to healthcare through this cancer hospital for folks on the South Side is a critical need. Right now, folks have to travel 60% of the persons on the South Side travel outside of the community to get care. And we know the statistics on that. The longer you have to travel for care, the more apt you are to delay care or just not get care at all. So having a cancer center on the South Side allows us to ensure better access to care for the populations that we serve here.
Yeah, that's just such an important thing. Dr. Smith, I know one of the things that you focus on in your career is health disparities, and we've talked about health disparities on the program in the past, but particularly in the area of cancer, it's significant. And can you discuss that a little bit? And what are we seeing there from your standpoint?
Yeah, so cancer disparities, I think, is a really important area to understand. And when we think about disparity, it is a difference in outcome, and it's not based necessarily on biology or anything that is scientific. It's really based on differences in what's called social determinants of health, access to health care, and socioeconomic factors. And this is really important and is very vividly shown when we look at cancer disparities, for example, based on race. Some of the more common cancers, for example, something like cervical cancer, the differences in survival, the differences in mortality are very different within our city, almost entirely based on geography and access to health care. So to give some details around that, for cervical cancer, if you live in the immediate area on the South Side, the mortality is almost as poor as it is in several countries around the world where poverty is the dominant socioeconomic status. Whereas if you go to the north side of the city or if you go to the northern suburbs, the mortality is some of the best in the world. Those kinds of differences are not based on race. They are based on differences in access and differences in the ability to deliver great care to the people who need it the most.
Well, and there are also issues with geography too, if I'm not mistaken, correct? Because I mean, that seems like I'm oversimplifying, and I am probably, but even when we look at pollution and industry and things like that, there are significant differences there between, for example, the south side of Chicago and the north side of Chicago, which I would imagine would potentially have some impact on those numbers.
Yeah, I think a lot of that has to do with prevention and the quality of healthcare even before somebody has cancer. Do they have access to an education that allows them to understand how they can empower their own health? Do they have preventive measures such as pap smears, mammography, low-dose CT scanning for lung cancer? Those types of outcomes are very different. And as you mentioned, the environment, the pollution, the ability to have food that is fresh or healthy, all of these differences are very starkly, I think, displayed when we look at outcomes in cancer survival.
You put that so much more eloquently than I did, so thank you for that.
Question.
Brenda, can you talk about the community needs health assessment, because that's some work that your team does and is heavily involved in, and it really, I think, gives a great look at what's going on. Can you discuss that a little bit, and where
Sure.
can people see that if they're interested in that kind of information?
Yes. So every 3 years, we conduct a broad-based community health needs assessment where we collect data directly from community members. This is what we call primary data, when we hold focus groups and do stakeholder interviews and survey the community, asking them what are the most pressing issues that you're living with from day to day. And then we look in the secondary data. These are data that are available to us through the health department, through the Center for Disease Control, and other secondary data sources. And we compile that data together with the community members, and particularly our community advisory council members, to look at and determine what are the priority health issues that we should be addressing. And cancer stood out as one of the top priorities out of that needs assessment for our community, with data that actually validates the things that Dr. Smith just said. And we post it on our website. We make it available to anybody who wants the data. They can access it, they can download it, they can pull out sections of it. And we also create a more easy to read document, a 2 or 3 page document that will allow them to get the results of the needs assessment in a smaller dose. The larger needs assessment is about 200 pages, so we have to synthesize that down a bit so people can get the salient information that they need to help them to understand what's happening in their health.
But it's great information, and it really does kind of, I think, clarify what the situation is, or
Absolutely.
at least to a large degree what the situation is, and how difficult it can be to have health equity, which is something
Absolutely.
that here at UChicago Medicine we are working towards, and trying to be good neighbors, obviously, to the community.
Sure.
So, one of the things that I thought was kind of interesting when the information came out that we were going to do this significant project was that we really reached out to the community. And Brenda, I know your team worked on that. Dr. Smith, I know you're working on that as well. But talk to community members, talk to patients and former patients, and tried to get as much input. And I know that's an ongoing process.
Yes.
Can you describe that to us, and why are we doing that?
Because these issues affect the community. And it's their voice that will give us advice and direction in how we should address these issues. We can't do things for the community without the community. So it's critical that we get the community's voice in what we do to address these issues. And it's critical that we get their voice so we can understand the depth of what the needs are. We might understand an aspect of it, but the community understands, for instance, with cancer, the journey and beyond the journey and what the needs are. And we don't always know that.
Yes.
We need their voice to be able to have a full picture of what it is that we need to intervene with on behalf of the community alongside them.
And I've always thought it's nice just to talk to smart people and get ideas, because
Oh,
there are a
absolutely.
ton of ideas out there, and that's part of having, I think, those diverse opinions. There are things that you may think of or I may think of, but as a patient, we may not have been on that journey, so we don't know.
Absolutely.
And it's great to get that information. Dr. Smith, if you can, talk about some of the features of the Cancer Center, because I think this is so exciting. We're doing some really neat things. I know we've had a lot of people involved and a lot of organizations and designers and people looking at things. There's some really exciting things happening here.
Mm-hmm. So I think this new cancer center is going to be transformative for us. Not only is it going to give us a physical structure that will allow us to grow and offer the best care, but I think it's really going to facilitate the best research and bring teams together and to take care of patients in a more comprehensive way. Right now, we have care that is a little bit fragmented even within our own university because patients do have to go across and go to multiple different areas to see different specialists. And one of the more exciting things about this new building is going to be just the community sense that it creates, that everything is about the patient, that we can bring everything to the patient. And, I think you've probably heard the phrase, the cancer center of the future. And, what does that mean? And we've all been, talking about, and I feel very privileged actually to be a part of, some of these conversations as this building is being conceived and designed. But to think about what does it mean to center everything around the patient, and what can we do to leverage technology? How do we bring the latest research to help improve the outcome for patients with cancer? How do we provide all the supportive care that people need and deserve? And it's just incredibly exciting. And I think that's where the future is. The future is going to, continue to be patient-centric, but to make it in a way that is really easy for patients to get the best care.
It makes perfect sense. And one of the things that's kind of exciting about UChicago Medicine is I think we're pretty unique as an academic medical center, as a research institution. We can do some things that are fairly unique for patients. And clinical trials is certainly in that realm. I wondered if you could talk a little bit about that and what makes us so unique in that area.
Yeah. So clinical trials, are incredibly important in oncology for us to help improve outcomes for patients with cancer. And I think many people have seen that the survival of patients with cancer has doubled in the last several decades. This was hailed by the National Cancer Institute, and of course, we are incredibly excited. Clinical trials are the way that we get to that point in the future. And I think there's 2 points I'd like to make, if that's okay. One is that, when we do these clinical trials, there is a lot of effort and coordination that goes into them to make sure that they are asking the right questions, they're designed in the right way, and that we can offer them to all of our patients so that we can move the field forward. And so I really want this building to have the clinical trials and the research aspect sort of embedded within everything we do. But the other part of clinical trials that I want to bring up is that going back to the initial discussion about disparities and about health equity, we have many populations within our society who are underrepresented on these very important clinical trials. And we have to find a way to change our trials so that we can increase the number of patients, from some of the populations that have not historically been represented in the trials, so that we can make sure that the new advances apply appropriately, and different groups such as either based on race or based on socioeconomic data or even based on age. Older patients have also been systematically excluded from trials. And so with this new building and with what the University of Chicago has historically done incredibly well, we hope to really be able to marry those 2 things.
That's great. Brenda, let's talk a little bit more about community involvement, because I know it's critical to the success of this, obviously. Can you talk I know there's a big survey that's happening and that we've been involved in. You touched on this a little bit earlier, but can you talk a little bit more about that? How can people be involved in that sort of thing?
Yeah, so we've created access to the survey in a number of ways. Obviously through QR codes, there's an opportunity for a person to use their phone and get the code and then take the survey. But we're distributing the survey at various sites throughout the community, and we have an online access point for the survey. And so there's many ways that we put together for people to be able to access. And what we want to know from the community is, how do we build this cancer center that is patient-centric and that meets the needs of the community?
And one of the things we will do as the program airs, and we'll put a graphic up so people
Great.
can see that. And we really encourage people to jump on there and take the survey and
Great.
let your voices be heard, because that's how we're going to find out this information, or at least one of the avenues that we'll find out this information. So that's great. And Dr. Smith, I want to kind of end this segment because we actually have a couple of folks that we're going to involve here in a moment. Candace Henley is going to be on the program in just a minute to talk a little bit about community involvement. But I want to end from your standpoint, if we can talk a little bit about prevention and screening and how important that is and tips that you can give to our viewers, if that's possible.
Yeah, as we look at cancer outcomes, I think one of the most important pieces is to prevent the cancer from happening completely. And that's where screening and prevention come in. And for for the most common cancers, and there's several where, there are screening guidelines in place, whether it's for breast cancer, cervical cancer, lung cancer, prostate cancer, or colon cancer, we know that screening saves lives. And this is another area where the University of Chicago has been incredibly active to make sure that screening is accessible to all of our patients who are on the South Side and beyond. And being able to prevent cancer, I think, is really one of our priorities. Another way to think about it is, and this will also be part of the new Cancer Center, is that some of the highest rates of cancer are in people who already have a diagnosis of cancer. And this is where looking at genetics and screening for cancer risk will also be a very important part of cancer prevention.
Great. So we're going to take a quick break, and when we come back, we're going to have Candace Henley join us to talk to us a little bit about outreach on the South Side in our neighborhood. And we'll be right back with Candace here in just a moment. And welcome back. We're excited. We have Candace Henley is joining us right now. And Candace, if you can introduce yourself to our audience and tell us kind of about your role here in this whole process.
Sure. So my name is Candace Henley, and I am the founder and chief surviving officer of the Blue Hat Foundation, which is a colorectal cancer organization that was founded on my own personal experience through colorectal cancer. And my role through this is I'm part of the Community Advisory Council and lending my experience as a survivor and how, I guess you can say, guide the process of what survivors and cancer patients should need in a center like this.
Perfect. And talk to us a little bit about, just from your standpoint, what this means to the community to have a center like this built. I mean, this is we're pretty excited about it, I know, and I just want to get your thoughts on it.
It's life-changing. As a resident of the South Side of Chicago, for myself, I journeyed outside of the community, right, for my survivorship care. And when you don't know what exists, you tend to look outside or find what's familiar or ease of access or ease of information. And pretty much that's what it was for me. It was ease of information based upon where my primary care physician was located, and then based upon the information where he felt that I needed to be. So when you're going through something like this and you're looking for information, you want something that pops up and that's self-explanatory and guiding you through the process as to where you should go, what services they offer, what's available to you, and ease of information, because it shouldn't be hard to find information about care. Yeah. But what we're finding that it is hard to find information about care because you're going through pages and pages of information before you get to, hey, here's the number you should call if you're diagnosed with cancer. You're wind up going through multiple pages and multiple pieces of information before you get to that piece. And it shouldn't be that way. It should be something immediately. If you are diagnosed with cancer, here's who you should call. If you're looking for cancer screening, here's who you should call. So having something accessible right away is very important.
And just, I know this sounds like a minor thing, but just proximity is important. Yeah. I mean, the ability to get in your car or, get on public transportation and be there quickly makes a huge difference. Can you talk about what that was like from your standpoint? I mean, how stressful was that to have to travel and to jump through the hoops that you had to jump through to get the care you needed?
Yeah, it was stressful because I had to drive about 25 minutes away from my home, find parking. And then if you have a family member, if they don't live with you, then you have to pick up a family member or they're picking you up, and then you're making this journey, to where you're going to get your care. You have to pay for parking. And then just the fact that you're going through traffic. And during one of my recurrences, I wound up going out to Zion, Illinois, to Cancer Treatment Centers of America in March. And while we were out there, we were caught in a snowstorm. So if you're familiar with Chicago, you know our snowstorms are not easy to navigate. So we wind up being in 2-hour traffic,
Oh, gosh.
not really moving much, to get from something that took us 45 minutes to get to, now it's 2.5 hours. So you can imagine if you're tired from being there all day, you've had treatment, you've gone through doctor's appointment, you're exhausted. And then you think about your caregiver or the person that's with you, they're exhausted as well, mentally, emotionally, and physically. So having access close to your home is essential. It's important, and it can make a difference as to how compliant someone is in terms of their care.
So talk to us a little bit about, from your standpoint, the patient experience and what you're hoping to see here, and how important that is positive.
Well, what I'm hoping to see, as we talked about clinical trials earlier, the conversation was about clinical trials. The issue what we're seeing with a lot of clinical trials with patients of color is the rigidness of the clinical trial criteria. So a lot of patients aren't really participating because they don't meet the criteria, because the rigidness of some of these clinical trials, you have pre-existing conditions. Most people do, right? They have something, but that should not preclude them from participating in certain types of treatments and certain types of trials. So I would love to see that reinvestigated and looked through from a different lens as to access, because that's a part of access and it's also a barrier. I'd like to see the hospital create ease of use, just like we talked about having information readily available. Let's have information pretty much, like, what is it? You let your fingers do the walking, just like the Yellow Pages, being able to come right into the hospital and find whatever information they need to find about treatment, about care, navigating screening services, and information about when should a person be screened for certain types of cancers. And in addition to, if you have waiting rooms, have information about certain cancer types put into the waiting room at different locations, because information is received in different ways by different people. You have people that are visual, and you have people that are tactile, and you have people that are audio. So if there's information that's available, something that I can touch, something that I can see and hear, that's giving those that are waiting, for care, information that they probably wouldn't have gotten anywhere else. But you're also giving it ease of use, and you're making it accessible. And it's giving people information that probably they would not have had unless they looked for it on the internet. So if you're giving information about different types of screenings and different types of options and different types of cancer information, that gives people thought process. So I'd like to see something like that make it easier for patients to access.
Yeah, I think, one of the things, and Brenda, I think this has been discussed too, is just that navigation portion of the whole thing. Because, if you're a cancer patient, you're overwhelmed, and there's so much going on in your head because it's such a difficult time.
Yeah.
And I know that's one of the things that has been discussed, just that navigation. So perfect point. I do want to play a couple of sound bites from another patient. This is a patient of ours, Lisa Cohen, who is on our patient advisory board, and she's very involved in this. So I'm gonna play the first one, and then we can kind of talk about some of the points that both she makes and Candace makes as well.
We meet, probably every month, and we're meeting with design people who really have, they have agendas where they really are, interested in probing a panel of us patients to talk about exactly what we want to see, what and it's really down to from when you pull up, the valet, to when you walk in the door, what would be the most comforting for a cancer patient. It's an incredibly stressful time, to what the room should should look like, what the chemotherapy bays should be, how they should be designed. So it's really been incredible to have input and be able to provide direct information to people doing the designing.
Yeah, I think that's kind of critical to the success of all of this. And again, Brenda, that's the work that you're doing with your team to really do that outreach.
Yeah, absolutely. The voice, we said it earlier, the voice of the patient is so critical to designing and ensuring that we do really have a patient-centered cancer center. We can't have a patient-centered cancer center without the voice of the patient. When I hear Candace talk about her experience, it kind of breaks my heart, actually, to hear that she had to travel far and she didn't have access to the information that she needed, and it wasn't simple for her to find out or figure out what to do. Patients don't want to do that. Patients want to be able to know what to do in those times. And this stress of cancer is just compiled upon a number of other stresses. And we want to be able to mitigate that in a way that makes that aspect of our patient's life a little easier to navigate.
I agree 100%. Candace, you mentioned the Blue Hat Foundation when we first started. Can you tell us more about that? Because I was kind of intrigued when you were talking about that. And that's something that you started, is that right?
Yes. So I was diagnosed in 2003 with colorectal cancer. I was 35 years old. And in doing research, I didn't see any faces of color that looked like me. 35, mom with children, and trying to navigate colon cancer. They were either older white men or white women, or older black men or black women. And there was not enough data to support and to talk about what this looks like for someone that is living, because everything said this person died of colorectal cancer. And what I realized is that when you don't recognize you in a situation, you don't know that something like that is possible for you. And everything that I went through, from trying to find resources to trying to find care, assistance to help pay with my mortgage, because I was fully fledged employed with CTA, and I was unable to return to work, and essentially became homeless because there were no resources available to help me maintain my home. If I had an apartment, they would have helped pay my rent, but I had a house. No one helped pay the car note. And when you're a mom of 5 children, you're thinking about, how can I feed my family? And so we wind up going from place to place to place because A, I had cancer. No one would hire me because I had cancer. And B, my family, they did the best they could with what they had. And out of my experience, I looked at what was missing. And services and access and information. There were so many friends that I had, because they didn't know what colon cancer was, they connected it to HIV. So they walked away because they were like, oh, wait a minute, she has HIV. The education piece of this disease was missing. Resources as to what it takes to survive, because I was surviving. I didn't die, but then there was this part of, who do I see now, right? I go from in oncology to now I'm cancer free, but now who do I see? My primary care wasn't a part of my service, my care, because I was in the cancer center. So he doesn't know, what to do with me except treat me. But then there's the information about, what if I need food and lights and things. And so that was the part that people weren't thinking of. And I was like, we've got to do better for our cancer survivors, for our cancer patients, because outside of just having cancer, there's still life that we have to live. And no one is looking at the life outside of cancer. And that makes a difference as to how compliant a patient can be. Because if I have other competing priorities, like taking care of my children, I may not be able to make this appointment from 9 to 5, but I can make it on Saturday, or I can make it at 7 p.m. because now the kids are home from school, and I can go and have treatment at 7 p.m. or 6 p.m. So the Blue Hat Foundation was formed out of lack of information, lack of knowledge. And the more I talked to people, they kept asking, well, what's colon cancer? And I was like, why don't you know about colon cancer? And that to me was alarming, because if the community as a whole doesn't know about colon cancer, that means the information is not getting out there. How do we get the information out there? But also, how do we get the information out about a cancer that no one wants to talk about, that's not threatening, but also welcoming enough that we can make the conversation where they're willing to talk about it? And no one wanted to talk about colon cancer because of the location, because it was so personal. And so we had to find a way to make it where people would talk about it, but not only talk about it, but share the information. And so we developed an event called Blue Hat Bow Tie Sunday, where we encouraged the church members to dress up in blue on Sunday in the month of March, the best blues they had, because we recognized people didn't dress up for church anymore. But when they dressed up for Blue Hat Sunday, we also brought in community partners like the University of Chicago that would provide free access to screenings and information about colorectal cancer, in addition to testing for diabetes and high blood pressure. So we brought in a whole health system, pretty much free screening, so that patients and individuals at the church could get screened and information, and brought access to them where they were. So that information was able to get into the hands of the congregation, but they also took that information back to their family members and friends. And to my surprise, we had a lot of people reach out to us that didn't attend Trinity, our church, but they knew someone that gave them the information from the event that we had, and we were able to get them screened or information about screening.
That's fantastic. You know, Brenda, you said it was heartbreaking earlier. That's a crime, though, that we're allowing that to happen to people, and people not getting the support that they need, because in our country we should be able to do better than that.
I agree.
And it's just it's a shame. I'm so glad you're on the program, Candace, because I think that's just, it's important to highlight this, and you know, things can't get better obviously until people are more aware of it. So very exciting that you're part of this. We're about out of time. I want to give each one of you kind of an opportunity, if you have a parting shot or something that you want to tell people. And Candace, let's start with you, and Brenda, we're gonna end up with you here in just a minute.
Okay. Well, I would say that survivorship is like a new phenomenon, because patients are living longer. And like my journey, they were so focused on saving my life, they didn't realize that I also needed a quality of life. So I would simply say that as we walk through this journey and think about how the Cancer Center should be formed, add quality and quantity to this list, because quality is an amazing journey with the quantity of life that you have. So as they think about this, think about making quantity a priority, quality a priority, I would say.
I agree. I think that's very important. I did have one more soundbite I wanted to play from Lisa Cohen too, so we're going to do that, and then Brenda will give you your parting shot here.
It's so valuable. You know, like I said, University of Chicago does a million things well, but in any hospital setting, there's certainly room for improvement. And I knew when I was going through my treatment, you know, I got the most incredible care, and I had a brilliant team of physicians. But from an operational standpoint, there were things that could be improved upon. And I really was passionate about being part of the solution and not just complaining. So it's really been invaluable, you know, to be able to share my perspective.
I just think that's so great that all of you are involved. I think that's so important. Brenda, you want to end us up here?
Sure. I just want to call out what Candace has said and Dr. Smith has said. We've talked about social determinants of health, but I really think the biggest that we have to address really early on is this education. That I think if we can educate the community, if we can provide access to education, if we can inform people, that knowledge will help change the trajectory of some of these issues that we have heard from both Linda Cohen and Candace. And you know, there's a verse that I love, and it says, "In all you're getting, get understanding." And I think giving folks knowledge and giving them understanding can heal nations.
Well put. It was really fantastic. You guys were great. We are out of time. Special thanks to our guests for being with us today. And a big thank you to those of you who watched. Please remember to check out our Facebook page for a schedule of programs coming up in the future, and make an appointment online. You can go to UChicagoMedicine.org or give us a call at 888-824-0200. We will have more programs in the future as this Cancer Center becomes a reality over the next few years. So make sure you stay tuned and check back with us on a regular basis. Thanks again for being with us today. Hope everyone has a great week.